Hello friends, hello all kind and adequate people. Today we are going to talk about the fascinating, dramatic and sometimes frightening medical mystery of paraneoplastic syndromes. This is a condition that occurs not because the tumor is directly pressing on organs and metastasizing, but because the body itself is not responding properly to the cancer. These syndromes can affect the brain, nerves, skin, hormonal system, blood, virtually any system in our body. And the amazing thing is, sometimes they show up a month before the cancer itself is detected. They are like hidden alarms, important signs that tell us something serious is going on inside of us. And by the end of this video, we will have a clear understanding. What are the paraneoplastic syndromes? Why are they important for early detection of cancer? How can they masquerade as dozens of other diseases? What symptoms cannot be ignored? And what can we doctors do about it? This is one of the most intriguing intersections of immunology, oncology, and real human stories. What is a paraneoplastic syndrome? Let us visualize it simply. A cancerous tumor appears inside the body. It is the enemy, and the immune system is supposed to destroy it. But sometimes in the process the immune system gets confused. It sees that there are proteins on the tumor that are similar to proteins in the brain or nerves, and it starts firing in both directions at once. This is so-called friendly fire. But there is another variant. The tumor itself behaves badly. It starts secreting hormones or hormone-like substances where they do not belong. For example, lung cancer can secrete a hormone that causes blood sodium to drop to dangerous levels or calcium to get too high. So we have two main mechanisms: immune cross-reaction, antibodies or T cells attacking healthy tissue, and what is called ectopic secretion. That is, the tumor secretes hormones or cytokines in the wrong place and not in the right amount. The result is symptoms that have nothing to do with where the tumor itself sits. It can be weakness, seizures, rashes, arthritis, anemia, strokes, psychosis, fever. The list is huge. This is why paraneoplastic syndromes are called the great imitators. Why is that important? Because a paraneoplastic syndrome can sometimes be the first sign of cancer. Sometimes, for example, neurological manifestations occur months before tumors are found. A sudden rash, a blood clot, inexplicably low sodium in the blood, those can be clues that there is a hidden tumor. And earlier recognition is literally life-saving. Statistically, neurologic paraneoplastic syndromes occur in less than 1% of patients with cancer. It is rare, but a very serious condition to be aware of. Broader effects, such as hormonal disturbances or weight loss, are seen in 10 to 20% of cancer patients. They are most often associated with small cell lung cancer, breast cancer, ovarian cancer, lymphomas, leukemia, kidney, and liver tumors. Therefore, when a middle-aged or elderly person develops a strange set of symptoms, one should always wonder if it is a paraneoplastic syndrome. In my practice, such cases have been encountered, and it was attention to detail that allowed cancer to be detected in the early stages, and to make it clear how important it is to think about paraneoplastic syndrome in time, I will give an example from life, from the practice of my colleagues. A woman, a little over 50 years old. She came to her family doctor with complaints of reddening of the skin around the eyes and on the forehead, as well as muscle weakness. Skin manifestations dominated, so the doctor referred her to a dermatologist, but the prescribed treatment did not help. Her condition worsened, and there was marked weakness and even shortness of breath. At the second visit, the family doctor decided to expand the examination. He prescribed Rumo probes and NT-proBNP analysis, which reflects the load on the heart. The results showed serious abnormalities. NT-proBNP was high, and the Rumo probes were positive, including anti-nuclear antibodies. The picture was emerging as a manifestation, that is, the primary suspicion of an autoimmune disease that affected the skin, heart, and muscles. The patient was referred to rheumatologists, and the rheumatologist began to treat her according to standard protocols, hormones, cytostatics, and so on. There was no effect. The woman was getting worse. She went back to her family doctor, and it was at this point that the doctor suspected otherwise. After all, if treatment for an autoimmune disease does not work, then the cause could be something else. He remembered the paraneoplastic syndrome and referred the patient for a more in-depth examination. Eventually, a small tumor in the ovary and several foci in the pelvic cavity were identified. The primary tumor was so tiny that the gynecologist had not even noticed it before during ultrasound. The CT scan showed suspicious foci, but the biopsy was extremely difficult to take. By that time, the patient was already very exhausted, and even laparoscopic surgery was contraindicated. So, under ultrasound control through the stomach, endoscopist took a piece of tissue. The analysis confirmed the diagnosis. It was metastasis of ovarian cancer. As a result, the diagnosis was made, but time was lost. If the paraneoplastic syndrome had been suspected earlier, the prognosis could have been different. Now let us look at how different organs and systems can respond to cancer. Let us start with the nervous system, because these syndromes have the most dramatic manifestations there: limbic encephalitis. Sudden mood changes, memory loss, seizures, hallucinations, more commonly associated with lung or cervical tumors, cerebellar degeneration within weeks or months. There is shaky gait, speech impairment, and dizziness. This syndrome is associated with breast or ovarian cancer, sometimes with lymphoma. The classic antibody in laboratory testing is anti-O. Often this condition leaves irreversible consequences. Next, opsoclonus-myoclonus. Chaotic eye movements, twitching of limbs, impaired coordination. In children, more commonly associated with neuroblastoma, in adults with breast or lung cancer. Lambert-Eaton syndrome. Muscle weakness in the hips and shoulders, dryness, impotence, decreased reflexes. Symptoms improve after exercise, which distinguishes it from myasthenia. It is closely related to small cell lung cancer, myasthenia gravis with thymoma, a tumor of the thymus gland. Fluctuating weakness, drooping of the eyelids. Difficulty swallowing occurs in half of patients with such tumors, and in 15% of patients with myasthenia, the cause is thymoma, paraneoplastic retinopathy, pathology of the retina, painless loss of vision, flashes of light, most often in lung cancer or melanoma. There are also encephalitis syndromes, stiff person syndrome, sensory neuropathy. Most importantly, they masquerade as stroke, multiple sclerosis, or even psychiatric disorders. Then there are endocrine and metabolic syndromes. Tumors sometimes work like hormone factories. Cushing syndrome, for example, may be caused by lung cancer secreting adrenocorticotropic hormone, leading to weight gain, diabetes, muscle weakness, moon-shaped face, and hypertension. Syndrome of inappropriate secretion of antidiuretic hormone. Again, lung cancer, especially small cell lung cancer, causes water retention and a dangerous drop in sodium. Hypercalcemia tumors such as squamous cell lung cancer secrete parathyroid hormone like peptide. Symptoms: thirst, constipation, kidney stones, confusion, hypoglycemia. Some tumors produce insulin like growth factor 1, causing sudden drops in sugar, carcinoid syndrome. Neuroendocrine tumors secrete serotonin. Skin redness, diarrhea, wheezing, and valve damage in the heart. Skin and muscle syndromes. Sometimes the skin is the first to signal. For example, acanthosis nigricans, velvety dark spots in the armpits, groin neck. If they appear abruptly and obesity is excluded, then you should look for stomach cancer. Sign of lesser Trélat. Sudden appearance of multiple seborrheic keratosis, associated with gastrointestinal cancer, paraneoplastic pemphigus. Painful blisters and erosions, more common in hematologic tumors. Dermatomyositis, rash on eyelids and joints. Plus muscle weakness in adults. Up to 20% of cases are associated with ovarian cancer, lung cancer, or pancreatic cancer. Sweet syndrome, fever, painful red plaques, common in leukemia. Erythema gyratum repens. Redness in the form of 3 rings, almost always in lung cancer. Effects on blood and coagulation. Tumors may also change the blood strangely. Pure red cell aplasia. Thymoma, for example, blocks the formation of red blood cells. Leukemoid reaction. White cells increase in number so that it looks like leukemia, thrombocytosis. Excess platelets causing a risk of blood clots. Trousseau syndrome. Migrating blood clots in the veins, classic for pancreatic cancer. Non-infectious endocarditis. Sterile thrombi on heart valves leading to stroke. Disseminated intravascular coagulation in acute promyelocytic leukemia, simultaneous blood clots in vessels and bleeding, hematologic and musculoskeletal manifestations, paraneoplastic arthritis, joint pain similar to rheumatoid arthritis, but without joint destruction, a syndrome similar to polymyalgia rheumatica. Shoulder and hip pain, sometimes associated with myelodysplasia. Hypertrophic osteoarthropathy, thickening of fingers, joint pains, almost always in lung cancer, RSPE syndrome, symmetrical arthritis, with swelling of the hands in elderly men, sometimes associated with prostate cancer, palmar fasciitis in ovarian cancer, progressive contractures of the hands, kidney and systemic manifestations, glomerulonephritis, nephrotic syndrome in lung, colon, gastric, or lymphoma cancers, electrolyte disturbances, phosphate loss, bone pain. Cachexia, emaciation caused by tumor cytokines, fever and subfebrile states, especially in lymphomas. So how is it diagnosed? First, one should not engage in self-diagnosis. Specialists should be trusted. If neurologic symptomatology is suspected, then paraneuronal autoantibodies are checked. For example, anti-EU, anti-U, anti-ETEO, anti-RINMDA receptor, CVV, Ma amphiphysin. At first, antinuclear antibodies are determined in the blood. If they are elevated, then a more detailed analysis shows which particular antibodies are elevated. In certain situations, hormones are measured: adrenocorticotropic hormone, antidietic hormone, parathyroid hormone like peptide, cortisol, erythropoietin. We do CT, MRI, PET-CT, whole-body PET-CT, sometimes finds tumors that are not seen on conventional CT. It is also necessary to exclude metastases, infections, vitamin deficiencies, autoimmune diseases. Now, there are formalized criteria called PNS care, where the type of syndrome, antibodies, and the presence of a tumor are taken into account to classify a definite probable or possible paraneoplastic syndrome. About the treatment, the main rule here is to treat the cancer itself. Removing the tumor can completely remove the syndrome. In parallel, immunotherapy such as steroids, intravenous immunoglobulins, plasmapheresis in immune variants, or symptomatic treatments such as ketoconazole in paraneoplastic Cushing syndrome, bisphosphonates in hypercalcemia, anticoagulants in thrombosis. The result depends on time. Some syndromes are reversible with early treatment, others leave an irreversible mark. And the question is, why do you need all this? Why should you want doctors to know about it? Because many doctors do not know it, do not think about it, and your health, you have it only once. So you better know what I am talking about, because paraneoplastic syndromes are the warning lights on our control panel. If you or your loved one suddenly develop unusual rashes, unexplained muscle weakness, migrating blood clots, low sodium in the blood, strange neurological symptoms, these could be immune system signals of a hidden cancer, and if we recognize these signs in time, we can find the tumor before it spreads. In my practice, these things have happened, and it is through mindfulness that lives have been saved. Let us finally consolidate the information. Paraneoplastic syndromes are not caused by the mass of the tumor, but are related to immune or hormonal malfunctions. They can affect any organ, sometimes appear before the cancer diagnosis itself, and the cancer itself should always be treated, not just the symptoms. Supportive therapy reduces the damage, and knowledge of such signs saves lives. And I also want to thank my sponsors on YouTube and Patreon. I refer to you as fan club members. It is because of your support that I am able to make such detailed, evidence-based videos, and you know that you have my personal contacts, emails, where you can contact me directly, write to me, and get express consultation and feedback from me.